Yeah, so basically, we already know that the vaccine is really safe and everybody should get vaccinated as soon as they can. And this study basically compared between vaccinated individuals and individuals with COVID cases, finding that many of the severe adverse effects that were described, such as myocarditis, are much worse when a person is sick with COVID-19.
And is your impression that this will have an impact on those people who are still holdouts from the vaccine, or is there an idea that it's more ideologically rooted, less science-based, these decisions?
Yeah, I think that the majority of people who are not taking the vaccine are not doing so because they are actively against vaccines, but because they're hesitant. They are, they didn't have time to do it. They found many other excuses for not getting vaccinated. And I'm sure that this study that now proved beyond any doubt that vaccines are safe. And as we all knew before, getting COVID is much more dangerous than getting the vaccine. I hope that this will push them and convince them to get their first and second doses of Pfizer or any vaccine, because we know now that many other vaccines, even the ones that are not RNA based, are extremely, extremely safe. And this is basically the only way that we can end this pandemic. We cannot do it unless all the population, and I'm not talking only about Israel, but really the global population, is getting the vaccine. Because what happens is that when we have even a small fraction of the population that is not vaccinated, the virus will basically take advantage of this pool of hosts, of people who can get infected, and then along with the fact that the majority of the population is protected by vaccine, the virus will replicate, and the result is generation of new variants of concern that are even more transmissible. And then we will just keep seeing these waves on, and we will, we'll never be done with that unless everybody gets their vaccine shot.
It's truly been, I believe, shocking to much of the country to see the numbers getting to levels where they are now, which we haven't seen since really January, February, or almost at all since the pandemic, despite the high level of vaccination already. But where, in your assessment, are we headed from here? The outbreak again at the worst levels we've perhaps ever seen. Schools starting tomorrow nationwide. Is it inevitable that we'll see even more of a spike in new cases?
Yeah, so I think that we're at the peak of the current wave, and we're starting to be at the other side of the wave. So I do expect that numbers will get down. It's true that school year starts tomorrow, but I think that still the majority of the transmission and infection cases are not in schools. This has been proven by multiple studies that the education system, schools and preschools, are not the source or not the main source of transmission cases. I think that there are three main reasons for the current wave. One of which is the fact that the antibodies are beginning to wane off. So they are going down. The levels of antibodies are basically declining since most of the population got the vaccine in January, February, March. So we're already 6 months post the massive vaccination campaign that was initiated in Israel. And of course, along with the Delta variant that invaded and now took over the entire viral population. So more than 90% of the infections are due to Delta, which is also more transmissible than the other strains that we saw. And these two factors are being addressed, I think, by all sorts of restrictions in Israel that were brought back since July, when Israel lifted the majority of the restrictions, and also the third shot that is now given to all population in Israel. And I think that these two factors are they will address the current wave, and hopefully we will, start getting our life back soon until the next wave, probably.
And in the short, we have about a minute left here, but is a holiday closure still likely? Is it a good option even? What else can or should be done in the near term?
Definitely, this is definitely a factor, very scary one. And a lot of people here think that kids will who are not vaccinated, they cannot get the vaccine. They will get infected in school, and then after a few days, they will infect their entire their grandparents and parents in the holiday table. This is a possibility, but I really hope that the majority of the adult population will receive the third shot that will protect and stop the spread of this infection. And we know that kids, they can get infected, but they're still, they shed less virus than adults. They're less sick than adults. So I'm optimistic that closure is not needed at this point.